Hi, I'm David Miller, JT's ER physician. JT, a 22-year-old male, was in a motor vehicle accident with airbag deployment. He has hearing impairment but wasn't wearing hearing aids. He reports jaw and shoulder pain along with a headache and photophobia. His exam shows tenderness in the jaw and left shoulder and bruising consistent with SEPA trauma. CTs and x-rays show no acute issue. He has a concussion, temporal mandibular joint dysfunction, and a left shoulder strain. After administering pain meds, he's being discharged with rest, ice, and over-the-counter pain relievers. JT will follow up with his PCP and dentist, and I've discussed concussion protocols for a gradual return to normal activities.
Hey, I'm Meredith Jones. As an ER nurse at Northeast Regional Medical Center, my purpose is to provide rapid, compassionate, and high quality care to patients in critical and emergency situations, ensuring both their safety and stabilization. I'm dedicated to making quick decisions, advocating for patients, and working as part of a team to save lives in high pressure environments. When JT, a 22-year-old male, came in, it's important to get a report from EMS and provide a quick assessment myself. I prefer to use the MIST criteria when taking a report from EMS. M. Mechanism. Patient was in a motor vehicle accident. I. Injuries. Jaw pain, shoulder pain, head pain. Rated 7 out of 10. Signs and symptoms. Patient is stable in vital signs. T. Treatments given. IV was placed by EMS. Patient is medically stable and needing further workup of injuries, and also help contacting family. We will prepare him in a room and wait for the physician to come and see him.
Hi, my name is Amanda Smith, and I am your social worker for this case. I will make sure JT feels heard and supported as he navigates the stress of his medical, academic, and personal challenges by maintaining a respectful and collaborative environment. I cultivate a secure environment in which JT can voice his apprehensions, with a particular emphasis on his future, finances, and basketball. I also prioritize the input of all team members, including dentists, physicians, and family members, and guarantee that these viewpoints are incorporated into JT's care plan. I will make use of my role to fulfill JT's psychosocial and emotional requirements. I offer counseling to assist him in processing his trauma and managing anxiety associated with his physical injury, as a result of his apprehensions regarding his future in basketball and school. I maintain JT's academic and athletic standing by collaborating with the team to ensure his social and financial support, which includes liaising with the Financial Aid Office, Disability Services, and his coach. I keep everyone updated on JT's mental health status and emotional concerns while ensuring his.
Hey, my name is Harvey, and I'm JT's athletic trainer. My role is to address any musculoskeletal concerns and help manage the pain he's experiencing, particularly with his shoulder and jaw, which are crucial for both JT's athletic performance and daily activities. I'll work closely with his care team, making sure all aspects of his health are taken into account, helping him coordinate his medical appointments, and making sure he stays on track with his follow-up, necessary treatments, and that there's continuity in his care. Since I've known JT for a while now as a student athlete with our program, I hope to also emotionally support him as he processes his injury, offering him guidance on how to stay motivated during his recovery process. I understand he has concerns about his basketball career, his family, and the financial burden of medical bills. I'll help him process these worries, offering emotional support and connecting him with the necessary resources like financial aid and disability services. My role is to advocate for his.
Hi, I'm Joan Cole. I'm JT's physical therapist. My role as a PT focused on restoring movement, strength, balance, and overall physical function. After a meeting with JT mentioned that his main goals are reducing pain, regaining strength and mobility, and safely returning back to playing basketball. JT is still experiencing shoulder pain, postural instability, and fatigue after daily activities. In terms of intervention, I'll need help from both JT, the family, and also my team in addressing pain and strength with manual therapy and progressive exercises, vestibular rehab for balance and postural control, safe movement strategies for caregiving with OT, and coordinating with OT and the athletic trainer to ease JT transition back to playing basketball. Hi, I'm Ashley Baker. I'm JT's occupational therapist. My role as an OT is to ensure that JT regain his independence in performing his ADLs and IADLs. After meeting with JT mentioned that his main priorities are eating comfortably, keeping up with school, helping his younger brother, and of course returning back to playing basketball. JT is still struggling with jaw pain, cognitive fatigue, and shoulder limitation, which is affecting his daily activity. I will work closely with the team and both the family to ensure that I can modify JT's surrounding to ensure that JT is able to regain his independence.
I'm Dr. Lisa Sales, JT's dentist, and the social worker and I will work together to make sure that JT's care plan meets his emotional and mental needs. JT worries that his neck pain is making it hard for him to talk, eat, and play sports, and it means that everyone on the team needs to talk about it carefully. I will make sure he gets the help he needs to heal properly, including a referral to oral and maxillofacial surgery if needed. I will also give him tips on how to deal with pain and what foods he can't eat to make his discomfort as little as possible. Helping the team by taking care of JT's teeth and oral health issues like fixing his broken tooth and taking care of his jaw injury in this collaborative setting.
Hello, I'm Dr. Hannah Milner, and I'm JT's audiologist. My role in JT's care is to address his hearing challenges and provide strategies for communication. I plan to place his interests and the concerns of his family at the center of my approach. For instance, JT has expressed concerns about his academic performance and his ability to hear health-related instructions, and his aunt is worried about his well-being. These concerns are important to me as I want to mitigate any extra stress during his recovery process. To ensure continuity of care, I plan on maintaining consistent communication with his care team, specifically using an electronic health record system. To ensure effective communication with JT, I will provide him with written instructions and summaries of his appointments, especially considering his hearing challenges. I will also update his family to ensure that they are involved. I will regularly monitor JT's progress, ensuring that all interventions are effective and adjusting treatment as needed.